Hi, I'm Olga Acosta Price. I'm an associate professor in the Department of Prevention and Community Health, a clinical psychologist by training, and director of the Center for Health and Healthcare in Schools at the George Washington University. I'm so pleased to be with you to talk today about being change makers for youth mental health. In addition, I wanted to tell you a little bit about quickly my center, which is a national resource and applied research center that is at the university and envisions a society where school and community environments really work together to foster health and opportunities for all students to thrive. I mention that because it really does frame and does inform the work that we do and that I help the center lead. We utilize a public health approach, which means that we maintain an emphasis on the social and environmental factors that impact outcomes that are important to all of us across the social ecology. And that collaboration is at the core of everything that we do, which means partnering meaningfully with local, state, national stakeholders so that we advance school-connected initiatives to improve student mental health and overall well-being. Again, I mention that because it really does inform so much of the talk that I hope to have with you today. And I first want to mention, in addition to introducing myself, it's critical that I also introduced my co-presenters. Um, I am pleased to introduce to you a number of DC youth leaders who will be featured throughout today's conversation. Julian Lopez, Belinda Alcocer, Carmen Brito, Daniela Mendez Castro, Tiana Gay, Anisha Marie, and Marcus Williams. You will hear from them directly throughout this presentation, but I implore all of us that if we want to be change makers for youth mental health, then I hope that I convince you by the end of this time together that doing so without the active participation of youth and their voice will be detrimental and diminish our impact of our cause. So because I feel strongly that youth have an important perspective that we should learn from, I wanted you to know that I'm actually co-presenting with my virtual presenters, young people, who are going to talk about their own lived experiences and their perspectives as young people in DC. So, as you know, we're going to talk about mental health. So it seems appropriate that we first define what we mean by that. Mental health is actually more than the absence of mental illness or mental disorders, which is often confused in public discourse. It's the ability to live happily and productively, to experience the capacity for personal growth and development, and to live life to the fullest. So ultimately, one can have a mental illness and still experience mental health. And there's many things that we can do to help promote our own well-being and mental health. I want to share with you one of my favorite quotes that reminds us that we all have mental health and that we should attend to it. It's a quote by a researcher from the United Kingdom, Lynn Fridley. And she says, everyone has mental health needs, whether or not they have a mental illness, just as everyone has physical health needs, whether or not they are sick. So again, it's a really critical part of the message that I share, but that actually the youth, when they use their own voice, will describe even more powerfully about how we all have mental health needs. And it's important that we attend to those needs as we learn and grow. The impact of attending to our mental health throughout the lifespan, we know to be important. Positive, strong mental health and experiencing emotional well-being has lifelong and even intergenerational impacts. When we think about our infancy and early childhood, we know that that often means important and strong, reliable attachments to adults. It means that we are fostering healthy brain development. As we enter school, we know that positive mental health impacts mean usually better engagement in school, better academic performance and test scores. It also means not being involved in or reducing one's involvement in risky behavior, less substance use, fewer instances of pregnancy, not being involved in the criminal justice and the juvenile justice system. It also means when we're attending to our mental health that we're more likely to graduate from high school, that then we're also more likely to earn higher annual incomes and salary. We often also, as those positive impacts accumulate, have decreased health costs compared to those who haven't had the same opportunities to attend to their mental health, improved health overall, and then ultimately the intergenerational cycle of the positive impact of mental health can be felt for future generations. But the reality is that as a nation, we have not traditionally focused on the importance of maintaining our mental health, and the toll has been significant. What we know is that currently, roughly 21% of adults, almost 53 million in the US, experience some form of mental, behavioral, or emotional challenge. Almost half of US adults will experience a mental illness in their lives, but only about 40% will receive professional care within a year. And the cost, not just to individuals, but also to society as a whole, is extensive. The total cost of mental illness is over 200 billion per year in the US, including over 100 billion in healthcare expenditures alone. Data from national surveys tells us that a similar prevalence is seen among young people in the US, and that includes both their prevalence and their likelihood to receive mental health treatment. Over 2.5 million young people in the US have severe depression. Youth who identify with more than one race are actually at greater risk than those who don't. The lifetime prevalence of mental disorder among US adolescents 13 to 18 years old is about 50%, with 22 having what would be considered severe impairment. And over 60% of young people with major depression do not receive any mental health treatment. Furthermore, racialized violence, ongoing gun violence, recent acts of domestic terror have contributed to collective trauma that no one is immune from, especially children and adolescents who are still developing and learning how best to cope with such tragedies. So, what are youth telling us impacts their mental health and well being?
Right now, I guess something that's really hard as being a teenager would probably be like the stress, because a lot of things are happening right now in the world, and it could be really stressful for a teenager or really anybody. But as a teen, like you're growing and learning, and as this is happening, a lot of negative things are also happening at the same time, and it can be really overwhelming. And it's very important to like make sure you're in a good community so then it doesn't get too stressful.
Expectations like either people like your parents or your teachers could have for you that you feel like if you don't meet, it just causes a lot of stress?
Also, I feel like especially right now during these times, it's like social media because like right now is a time where there's like the most like modern technology than before, especially with all these apps like Instagram, TikTok, Snapchat, like all that type of stuff. And I feel like a lot of teenagers try to like fit in, I guess. And I feel like that can be like a pressure for a lot of youth right now.
Also like school, and like thinking about your like future and stuff, like most of us are like about to be done, well, like we still have like 2 years left in high school, but still like we're still thinking about like what's gonna happen, so we're like stressing out, and like and like also with schoolwork and like with the pandemic going on where we had online school, like some people like fell back on their work and like they had to get used to like being back in like the school environment this year.
Also, I'm 15, so and like a lot of things at home go like different. So like it's like you gotta manage home and school, and with that, like I'm trying to get a job like to help out and stuff like that. So it's like with school, and it's like you got to do community service hours, get a job, and go to school. And then like my weeks be booked up because I be trying to get community service hours and stuff. So it's like it's hard to like get a job and just focus on school, but like it just school is not it.
The disparities for Black, Indigenous, and people of color are notable. Black youth are less likely to get treatment for depression than their white counterparts. And when they do receive treatment, it is often of lower quality, and social stigma, social determinants of health, and a historic mistrust of healthcare provider play a role in their ability to access care in a timely manner. Since 2007, the death by suicide rate in Black youth aged 10 to 19 has actually increased from 2.55 per 100,000 to 4.82 per 100,000 as of 2017. Suicide attempts and death by suicide in Black youth has been increasing at a faster rate than youth from any other race. So why would I argue, given the statistics, that we should focus on youth now more than ever? Because studies show that most symptoms associated with adult mental illness actually show up early in life and remain unaddressed. Statistics indicate that half of lifetime diagnosable mental illnesses and symptoms associated with them actually start by around age 14, and 75% of those with adult mental illness indicate that their symptoms start by age 24. When mental health needs remain unaddressed, the impact is severe, not just in adolescence, but the consequences are dire well into adulthood. What we know is that children exposed to cumulative stress, so a number of stresses occurring at once, are 4 to 12 times more likely to have substance use problems, depression, suicidal behavior, and to be more likely to smoke and have sexually transmitted diseases in adulthood. Chronic stress is also highly correlated with greater risk of medical disorders such as heart, lung, and liver diseases, inflammatory diseases, and even cancer. So what can we attribute the prevalence and the disparities of youth mental health to? I would argue that much can be attributed to context, the conditions in which we live, work, and learn. One important example is shared directly by a young woman from a metro area who tells us, "My whole life is stressful. I ran away from home. There were like 13 people in that house. After a while, there's not enough food and everything for everybody to be there. One winter, we had no heat, we had no electricity, we had no water. It was bad." We have worked in partnership with the National Center for School Mental Health and the School-Based Health Alliance to define and describe these social determinants, what we call the social influencers of health and education. Because although these factors are highly influential and related to poor outcomes, they are not deterministic of youth trajectories. Although extensive research shows that the current mental health crisis affecting adolescents has long preceded the pandemic, stemming from a range of social, economic, and other systemic factors, conditions actually have worsened over the last few years given the impact of COVID. The past 2 years of living through a pandemic have taken a significant toll on everyone's mental health, but it has hit some groups harder than others. National statistics indicate that African American and Latinx adults have experienced more behavioral health symptoms during the pandemic than any other groups, and report increased concerns, not just about the pandemic on their own lives, but the impact on their children's education. Also, an estimated 140,000 children lost a primary or secondary caregiver during the first 14 months of the pandemic, and 65% of those were children of racial and ethnic minority groups. National reports showed that African Americans had higher rates of economic and mental health hardship than white adults, according to an analysis of the U.S. Census Bureau's Household Pulse Survey. This has led to calls from large advocacy groups to declare a national child mental health emergency last year, with the Biden administration announcing a federal strategy to address a national mental health crisis that now exists in the U.S. What has been missing from this discourse is the essential role of youth leaders and youth engagement in the solutions that are necessary to overcome these persistent challenges. Youth voice provides compelling insight into the challenges that adolescents face in accessing mental health care. When asked, they point to systemic issues like lack of consistent and accessible resources for themselves and their families, And youth are clear that we as adults are not in touch with what has been going on for them, and we have not been effective at addressing the factors that are causing this mental health epidemic. What have DC youth been saying specifically? Let's hear from them.
Hello, my name is Natalie Cheatham. I am 17 years old and I will be attending Georgetown University. This project's importance is ingrained in youth engagement. We want to encourage and support youth involvement in fighting our current mental health crisis, as it is clear that the adults in charge haven't been able to make any progress. This project hits close to home for us in DC, as DC is currently facing one of its worst mental health crises. Most years, students are required to fill out a youth risk behavioral survey, and the most recent YRBS survey recorded that 40% of high school females and 25% of males felt sad or hopeless for almost every day for 2 weeks in a row, which is a major indicator for depression. Also, 20% and 14% have had plans to kill themselves, and even worse, 15% have actually attempted suicide, which is double the national average of 7.4%. These statistics disproportionately affected middle school students, teen students of color, and LGBTQ students. We want to be the change to solve this mental health crisis.
Results from a local DC well-being survey conducted by our partners at Empower K-12 mirror some of these same unsettling patterns we've seen at the national level. Almost half of DC youth respondents, about 47% of more than 1,600 students across 18 charter schools, said they were concerned with their family getting COVID, with over half also reporting that they had to quarantine at least once this academic year. And sadly, 47% indicated they had indeed experienced the loss of an adult in their lives in the past school year. Across all 1,600 respondents of that survey, 1 in 5, or 22%, said that they felt lonely most days. Students want access to counseling in and out of school and to make sure that they're readily available, but they don't tend to know what resources exist or how to access them. This is what they tell us.
Even with like the resources that we do have at like Jackson Reed, it still isn't known that we have those resources because no one's announcing that we have them to use. No one says, oh, come use this, or we have this for you, because it isn't really talked about much at our school. And it should be. Like, we have daily announcements, and we can be using that as a way to spread awareness, or to use that as an access, or like a point where people can get help from, or know where they can get help from. And a lot of people in my school don't even know who their counselors are or who they even could get help from. So I think if there was a way for us to let people know that there is a way you can get help, or there is someone you can talk to at the school, I think it'll be like easier for people to learn more about mental health.
The positive news is that 86% of those respondents also said that they could identify an adult that they could go to if they needed support. We know both from research and anecdotal evidence that teachers and school staff and health providers often represent this group of safe and caring adults for youth. But not only have they personally reported many negative impacts of the pandemic on their own well-being, 87% of DC teachers, 350 in total across 16 charter schools, reported that they were weighed down by concerns about their students' well-being and their academic growth, as well as the same percent of educators saying they were worried about their colleagues' well-being. And our students are telling us their well-being is compromised by the many adverse conditions they contend with. The impact of contextual issues such as food insecurity and safety issues have a significant impact on their mental health, which is evident in the student well-being survey that I referenced earlier. At the beginning of the school year, student self-reported well-being showed that 58%, more than half of all respondents across age and grade levels, said that they struggled with managing their own stress, while roughly 40%, less than half, said that they can generally manage their stress on their own. But that percentage did appear to improve by the spring of this year. Although I caution us that these are different groups of students, so a true comparison is not possible, but we should take some solace in the idea that there may be some improvement as the school year moves on. Differences between elementary and middle school students are also worth paying attention to. The same survey results tell us that 64% of elementary school youth, about 422 young people, said that they felt that they belonged, at least quite a lot at school, while a little over half of middle school students said the same, about 400 out of 490 students. Across both groups, saying you felt that you had a lower sense of belonging at school meant that they also reported a much lower sense of mental well-being overall. In addition to these resource and service challenges, Black adolescents in DC reported an average of over 5 experiences of racial discrimination per day, per a recent DC study. These overt experiences or microaggressions related to racism can lead to helplessness and anger that can compromise mental health. So, although there are many factors that can contribute to reduced well-being and poor mental health, youth acknowledge that stigma and cultural barriers continue to prevent help seeking and can discourage the access and use of these resources when they are available. What stigma involves are 3 essential elements: a lack of knowledge or ignorance about a particular group or population, negative attitudes or prejudice, and then behaving in ways that disadvantage that stigmatized person or group, which is known as discrimination. So, what do our youth tell us about how these issues impact them?
It's kind of like you can't tell people, like people be like, why do you have a social worker? Or like, why do you see this person, or why, like, what is its purpose of this? And I started that. And I'd be scared to tell them because it's like it's a lot of background from why I have a social worker, and I don't want it to define me, but that's why I see a social worker, so that way I can get help on it, because me trying to help myself, I done been through a lot trying to help myself. So it's like I can't really tell people, oh, I have a social worker because this, that, and the third.
For a lot of like Latin and Hispanic households, like mental health is really like a topic that is like really talked about, and I feel like that can be one of the reasons too, because it's like at schools, not only like is there like a lower percentage of like Latin students, but then also it's like it's not a topic that's talked about a lot, and I feel like those 2 things like together is one of the reasons that there's not a lot of resources for like Hispanic and Latin students.
Like, some, like maybe not all of our parents, but like, some Latin, like from the Hispanic or Latinx community, some of our parents like didn't grow up like expressing their own feelings, and like with like Julian was saying, with no understanding of mental health, so they don't like really know how to like execute that out to their children, or like what to do when like if their children are going through that. So yeah, this like learning what it is like could really help.
So, what can we as adults do to provide sufficient mental health care and support to adolescents? Really requires that we think about a holistic, comprehensive approach. One of these approaches, I'm so proud to say, is actually occurring in DC. The expansion of comprehensive school behavioral health systems is an investment that has been made by DC policymakers, DC agency leaders, parent and family advocates, and providers across the city. Improving student well-being using comprehensive school behavioral health systems means that we're improving access to care that often prevents young people, particularly from disadvantaged neighborhoods and under-resourced settings, to actually access quality care in a reliable and timely way. We can offer a continuum of services where they spend so much of their time, which is school, and also engage in processes for early identification and screening so that we can intervene earlier rather than waiting for examples and evidence of failure in order to indicate that treatment or support is needed. It also promotes youth, family, educator, and peer engagement, and I'll say a little bit about that moving forward, but also takes advantage of and supports enhancing nurturing, safe, and respectful climates that are so essential. We're proud to have worked with our national partners and others to put together a guidance document called Advancing Comprehensive School Mental Health Systems, which is a guidance to the field. In it, we say that schools are a natural setting for collaboration across partners to promote student well-being and to support early identification and intervention for students with mental health concerns. The core features of a comprehensive school mental health system are numerous, but foundational and so critical to establishing sustained systems of care for youth. We need to invest in well-trained educators and specialized instructional support personnel because their influence and power and involvement in school mental health systems is critical. Family school community collaboration and teaming must be prioritized for school behavioral health systems to be effective. We need to think about needs assessment and resource mapping so we can leverage existing resources and bring to bear all the partners and resources available in the community. Multi-tiered systems of supports, which I'll mention and define in a moment, as well as thinking about how to incorporate mental health screening, evidence-based and emerging best practices, and making sure that our decisions and our actions are based on data, really engaged in data-driven decision-making. And also thinking about the ways that we can braid and blend available funding so that we can sustain and reliably make available these services long-term. What we mean by a multi-tiered systems of support is a framework that is used in schools to really match needs to available resources. This continuum of services are really necessary to create the safety net for the entire school population. It is built on a foundation, again, of professional development and support for a healthy school workforce that includes educators, that includes leaders, staff, and providers. And it's also built on the foundational element of school community partnerships. Tier 1 essentially means that we are providing universal support to promote positive social, emotional, and behavioral skills and overall wellness for students, but also for staff. What are those strategies that are being used and are about really building competencies and skills for everyone in the building? Tier 2 are the supports and early interventions for students identified through a needs assessment or through screening because they're at risk for a poor mental health outcome that we want to try to prevent. And Tier 3 are targeted interventions for students with more serious or diagnosed concerns that we know are impacting their daily functioning. What this looks like when we are thinking about applying this multi-tiered system for social and emotional well-being is that we have promotion and universal prevention programming such as social and emotional learning curriculum, mental health first aid, positive school climate, activities, and just school-wide trauma-informed practices. What Tier 2 interventions might look like in schools is screening for depression or suicide, primary project or PBIS, check-in, check-out interventions, or just the use of behavioral contracts for young people who need support around managing their own emotions and behavior. And evidence-based Tier 3 interventions include trauma-focused CBT, family-focused therapy, and just wraparound and care coordination for those who may have multiple providers or professionals and specialists involved in their care. So what does it look like for some young people to receive mental health supports in schools? Let's ask one of our DC youth.
In my opinion, talk therapy is good sometimes, but sometimes depending on like the situation or like why I'm currently going to therapy at that moment, I feel like it's better to have like I'm pick like when I did have my therapist, she would usually ask me how I'm feeling and then she would present me different options to do while we talked. So like sometimes she would have me solving this puzzle or we'd be talking about something that I want to do in the future or maybe like college plans. I do visual arts, so I definitely like art therapy. Like my own form of art therapy is like drawing when I'm in class or if something happens, I'll probably listen to music and draw. I really do like when I can kind of do something with my hands while I'm talking, because if I'm just talking and I'm not really doing something with my hands, then I won't really feel as focused. It just helps to take my mind off of what I'm thinking about so that I can express myself through my words, but also I have something to express myself throughout my hands. Since I actually fidget a lot, so I like move a lot around the time, and it's hard to think whenever I'm not like using my hands for something. So I tend to like having something in my hands or like doing something while I talk. So I'm like more of a hands-on type of learner, expressor person.
Although young people recognize the problems and the challenges, they always have solutions, ideas, and want action by and with adults. So, what do you tell us can help reduce stigma and improve the cultural divide with parents to improve their access to mental health care?
There's always going to be stigma because there's always going to be judgmental people. And it is definitely hard to convince somebody to stop believing something they've believed their entire lives. But I mean, I think for reducing it, maybe not stopping completely because that's kind of not really possible right now. But I think for reducing it, we just kind of have to let it be known that getting mental health and having somebody to help you with your mental issues is a normal thing, and that it shouldn't be looked at as if it's a disability or a weakness or any of the sorts, because that's one of the main things, because nobody really sees a lot of people talking about the good part of getting help, and they tend to believe based on what they've been raised to be believed or who they see or things in movies or shows, etc., that getting help is making you weak, when in actuality it makes you strong, and that should be advertised more.
I think that could help reduce the stigma would be just talking about mental health overall, like just talking about it more and making it a topic that's more important. And then also I feel like one of the motivations that they would feel to want to come to like these resources that would be provided is like having like I don't know, like a teacher or someone that's like already a part of like that's wanting to help the parents. I feel like for a lot of Hispanics and Latin parents, it's like if they know someone that's like that they have a connection with that's already a part of it, they're more bound, I guess, to want to join in too.
Young people have so many ideas of the ways that they can support their own and each other's mental well-being. But the evidence on effectiveness of peer-led prevention and early intervention strategies or peer support is scant. But youth have been involved for many years and in many ways in programming to improve mental health literacy and awareness, increase help-seeking behavior, to reduce the stigma associated with mental health, and ultimately to increase the utilization of mental health services. Some of these interventions have been quite innovative, like smartphone app or web-based interventions that have been developed in collaboration with young people because they're widely believed to be more in touch and to help create relevant and impactful interventions that would otherwise not be able to be developed without their input. But again, little research exists to really confirm that conclusion and the effectiveness of many of these interventions. Some early, though, preliminary evidence suggests that positive impacts to both peer leaders themselves, as well as the recipients of peer support programs, include improvements in awareness of mental health conditions, indices of personal growth and identity development, and interpersonal factors, and expanding a sense of opportunity for the future, as well as behavioral changes like reduced drug use intentions for youth who have been involved in social media campaigns. Some of these effects can have far-reaching impact even into adulthood. So, what are some of the local examples of ways young people have been co-constructors of effective, innovative interventions? I'd like to introduce you to the Young Women's Project, the Mental Health Challenge, Student Online Support, or SOS. But young people can better explain what this intervention is about.
My name is Noemi Durand, and I'm a rising senior at Basis DC Charter School, and I'm super passionate about mental health. In fact, I'm a youth mental health advocate with the Young Women's Project, which builds the leadership and power of young people to take on DC's most pressing problems. I'm on the mental health campaign team this year, and I've been working with YWP for 2 years now. Driven by the COVID-19 emergency and rising rates of already high depression and suicide among DC youth, the mental health campaign was launched by youth leaders in 2019 to aim to strengthen school-based mental health programming, connect youths to services, and expand mental health and wellness education. Our 2022 campaign work featured the Student Online Support, or SOS, which is a virtual wellness center. It was created by youth for youth, and it connects students to their school's counselors and clinicians. Students can also learn more about the impact of stress, toxic stress, trauma, and resilience building, and what resources are out there to help. YWP youth staff developed over 13 SOS sites, and each one has almost 200 resources.
Hi, my name is Alina King. I'm 16 years old, and I attend Jackson Reed High School. I am a youth staff member for the mental health campaign, and I have been working there for several months now. One of the reasons why I joined was because I am very interested in mental health. It's also because I know that many students at my school struggle with mental health, and they don't really have a lot of accessible resources. They don't know a lot of information on mental health, or they're just not comfortable going to an adult to seek help. And that's also the reason why we created these virtual wellness centers. They're basically just here so that students who have mental health issues or know someone with mental health issues can have a place to kind of do their own research if they're uncomfortable talking to anyone else, where they can get good information and they can kind of understand more about it. And there's a lot of variety in the virtual wellness centers. There's also rooms about sleep, for example, which I did. And basically in my room, I just explained why we need sleep, why sleep is good for you, what to do if you're not getting enough sleep, and maybe why you're not getting enough sleep. Things that you may know, you may not know, but you never know what you can get that might be of great help to you or to someone who you know. Virtual wellness centers can also be good for parents who have kids who struggle with mental health and they want to learn more about it. Our virtual wellness centers would be a good place to go.
My name is Dalshad and I attend McKinley Tech High School. I'm a youth staff member at YWP on the mental health campaign team, and I have worked 1 year with YWP. Mental health is an important issue for youth at my school because mental health can affect our education and motivation. Some of the barriers that face accessing mental health resources are not having any trusted adults or enough counselors to share concerns with, and the stigma around mental health stops youth from feeling comfortable enough to share. I decided to do a virtual wellness center for my school because my school needs more resources to support the students. I focused on stress and emotional health because I stress a lot because of my exams and homeworks. I think more students should take care of their emotional health to be healthier and happier.
I'm Kaylin Long, a 17-year-old student at Duke Ellington School of the Arts. I worked on the youth staff at YWP and YJC for 2 years. This program is really valuable to me since it allows me to expand my knowledge of mental health issues. Because of the lengthy school hours and heavy workload, mental health is a major concern for students at my school. We want to make sure that students are managing their mental health while juggling multiple responsibilities. We chose to develop a virtual wellness for my school since we thought it would be beneficial to the students. It would teach young people about good behavior and how to break free from toxic habits. It will be fantastic to tackle mental illness by educating the youth. We can reduce the stigma. For the virtual wellness center, I chose to focus on the trauma issue because I found that many young people suffer with their trauma on a daily basis. This is a serious issue, and many young people in this generation have experienced trauma but are afraid to openly discuss it or seek help. My topic is significant for young people since it will help them feel at ease while building resilience to heal from their trauma.
Hi everyone, my name is Sian Tekle Habtagaber. I'm 17 and I'm a junior at Basis DC. Over the past year, I've been a youth staff member with the Young Women's Project on the mental health campaign team. Based on my personal experience, mental health support has been an elusive topic at our school for quite some time now. Between our rigorous coursework, loaded curriculum, and countless extracurriculars, burnout is a prevalent issue among students, but sometimes it can seem as if we can't turn to anyone. As of right now, I've taken a total of 12 AP courses, so feeling overwhelmed and overworked are constant within my life. Many of my peers have communicated that they feel neglected in regards to mental health support, so we wanted to provide a space that can help relieve that. We decided to make a student online support center because it aims to educate students, teachers, staff, and parents on issues that oftentimes contribute to our mental health. Through the Basis DC SOS, we wanted people to learn about ways to approach their mental health, find a tranquil, safe space to de-stress and decompress, and share with those who might also benefit from such a resource. In our 20-plus room SOS, you'll find topics that range from trauma, toxic stress, gender identity, and dozens more. The intersection between puberty and high school can generate so many questions about oneself, especially the why as to how they've been feeling. Every room has been selected, vetted, and released with the intention of educating those who are interested in exploring them, even non-students like parents, teachers, and staff.
As a whole, this student online support has almost 200 resources for youth to find support and information, and I've personally gotten a lot of positive feedback from it.
So Although young people have really creative, innovative, and powerful ideas for what we need to do, what needs to be done to improve their mental health, we as adults have to be involved. They need allies. They need support from us. They need our assistance in the ability to implement these ideas. So, what are some of the action steps for us? For those of you listening, what could we do? So, I'd like to say that to promote youth mental health, we can think about 4 things: looking inside, looking outside, raising up, and pushing down. So, what do I mean by that? To look inside, reflect on our own assumptions and the implicit biases that we have about young people, about how they should look, how they should speak, and how they should share their ideas. Be aware of the language that we use and how it can serve to diminish or exclude youth voice from the ideas that we bring forth. We can also look across our organization and our agencies to review the practices that may actually serve to be an unwelcome environment for young people, and think about ways that we engage in tokenism so that we have superficial or shallow ways that we have youth representation in our organizations. Ultimately, we want to reinforce a culture of curiosity, of learning, and of mutual respect, regardless of age or perspectives. Then we need to look outside of our organization. Think about ways that we can identify and recognize local resources and potential partners that exist in our neighborhoods and in our regions. And then think about ways that we can establish connections with those organizations or networks that may have aligned philosophies or agendas with our own agencies. We have to consider the ways that we can promote and support youth leadership opportunities specifically. What are the kinds of things that are happening that you might be able to promote and advance? Then we can raise up. We can use our position of power to advocate for recommendations from youth and assist in actualizing their ideas. We can elevate the importance of strong, comprehensive school behavioral health systems and all the components that are necessary for making sure that those systems function in a healthy and sustained way. And we can promote and support youth leadership, as well as comprehensive systems and their programs, practices, and policies, as well as advancing and promoting the research associated with these. And then we have to be mindful to push down things that are actually undermining of our cause. Identify and dismantle the discriminatory processes that hamper success for children and youth. Fight against the narrative that only adults can create or implement effective solutions, particularly for youth mental health. And challenge the arguments that the only way to improve youth mental health is by increasing treatment and clinical care, as opposed to prevention, promotion, and early intervention strategies that can very much be advanced and supported by youth engagement. So it's really imperative that we think about the ways that youth voice, youth ideas, and youth engagement will create value to what we're doing and impact our systems of youth mental health. Our concluding statements really need to come from our young people. So I leave you to them.
I feel like people should know that having mental issues is like, it's not a joke. It's pretty serious, and I feel like having the right care to take care of your mental issues is also a big thing that everybody should have, even if they aren't the brightest of people. I feel like they should still have it.
Basically, yeah, mental health is not a game. Like, mental health is something that should be always taken serious. Like, people think it be jokes and stuff like that. Like, it should be always taken serious. And even if you don't know what that person is going through, or what like type of mental health they got going on, get like serious. Even if you don't know what that person is going through, like, you don't like. Sometimes you can tell, sometimes you can't, because people put on different acts to what they're going through. So like sometimes just like, chill on it if you don't really know what's going on. If you would like to know, and if you feel like that, like you're somebody that's interested into that, pull that person to the side and talk to them, like, to understand what they're going through. Like, you know.
I agree with what Anisha and Marcus said. It's definitely not a joke, and it's definitely not something that should be laughed at, especially in serious situations. But another thing I just want to add is just that even though you might have mental issues, that it's not a problem, it's not a bad thing. It doesn't make you worse than anybody else. And you may feel as though you don't want to get help because you don't want to acknowledge it yourself, or you don't want people to find out about it because you feel as though you're definitely going to get judged. And you're not wrong. You will get judged, but you will also get accepted by a multitude of people because you're not the only person dealing with it. And everybody has some type of issues, whether they recognize it or not. And nobody should have to feel like they should hide from other people or even themselves just because of something going on mentally. And everyone should know that no matter who they are or where they come from, they are always going to be accepted by somebody and everyone at some point.
Mental health is really a thing for young youth, and also for adults too, because I feel like adults don't really want to say that they're going through certain problems just because I guess they're adults and they're supposed to be like the ones that have their life set already. But it's like, no, like you guys also have your own problem. It's okay. Like you guys also need these resources and you guys can reach out for help too.
Something I want to say is do listen to others, but also make sure to listen to yourself. And it's okay to express emotion. It's okay to talk to people.
And to ask for help when you need it. Like, don't be scared to ask for help.
So thank you again for your time, for your attention, and for your commitment to elevating youth voice, involving them meaningfully in the kinds of solutions that will make a difference. Thank you.